I
didn't get what?
You didn't have to go. You didn't get your jury notice today then?
No, they let me out of it because I'm helping run this meeting, and I had to meet with 5 drug court participants today. So I have to start tomorrow.
Oh, okay.
Doesn't mean I'll get picked. I just have to go through and sit and watch the videos and go through the selection process.
Right.
Look at all these beautiful people.
Hello. Nice to
Wayne.
see you, Wayne.
Haven't seen you in forever.
So, Alan, Wayne is here to cover Dane's portion because Dane's on vacation.
Okay.
I allowed him to step out for a week.
I was going to say, you gave Dane vacation? Really?
Yeah, it happens.
Yeah. Everybody needs a vacation now and again.
And Robin is the one who's here for the ADAPT presentation.
Okay,
So
let's give it
Robin.
a couple more minutes. Okay. Yeah.
Yeah, and if you don't mind,
We still
I think
got people coming on.
Yeah, I think like last time, maybe go through and have people just say who they are and where they work.
Be a good idea every time. I lose track.
Good morning, Chief Kloffenstein. Good to see you on there.
Good morning. I got a new camera, but I'm not sure how this thing's going to work.
It makes you look good. You must have spent some money on it.
Well, the second part is accurate. I don't know about the first part.
I do have something for you, Chief. I went to a Create and Sip to make something, and she had a bunch of paintings that she was giving away. I took a couple for our Grapevine event for canines, but someone had done a nice Roseburg Police Department one. So I thought you guys might like somewhere. So I took it to give you.
And what was it?
It's just a canvas that someone painted that said Roseburg Police Department, has the blue line across it.
Yeah, that'd be great. Although I did just get an email from someone who was talking about blue lines and why we would have any be associated with it and all the negative connotations. And I was like, you can meet with me in person and we'll discuss it. But yeah. He wants to be a keyboard warrior about it, and I'm not going to engage that way.
Doug, are you growing a beard?
Yep.
First time ever.
It looks amazing. I mean, if you took the beard part off, you'd have an amazing, like, firefighter mustache.
Easy now.
Okay, Alan, it's 11:32.
Okay, are you ready to go?
I think so.
Okay, so I'll call this meeting to order. Welcome everybody, and if we get more people on later on, we'll introduce them too, but let's go ahead and get started. First thing I'd like to do though, before we do anything else, is have everybody introduce themselves again, since I tend to lose track over a period of time since I only do this once a month. So can we start from the top and go across, and everybody introduce themselves and what their committee appointment is, or what they do for our group. Jesse? I guess
Good morning, everybody. My name is Jesse Spain. I'm the Regional Director of Painted Horse Recovery. We're a recovery center here in Roseburg. We just opened up in February, and it's good to see we have a lot of people coming in. Thank you.
Thank you, Jesse. Lindsay?
Hi, I'm Lindsay. I'm the nurse manager at the Behavioral Health Unit for Mercy Hospital.
And she was also newly appointed to Lipsick as a council seat.
Oh, okay.
Thank you.
Robin?
Hi, I'm a guest today. I'm Robin Peterman, Director of Operations, and I'm going to speak about our mobile medical clinic today.
Very good. Thank you. Welcome, Robin. Janelle.
I'm Janelle Kohler, the Executive Director for the Housing Authority of Douglas County, and I also help facilitate the HTAG, our local partnership of community agencies to address homelessness. We meet monthly, and I help facilitate those meetings.
Thank you, Janelle. Wayne.
Wayne Ellsworth, Director of Resident Services from NeighborWorks Umpqua, also the board president of Umpqua Heart, and I'm also one of the coordinators for the Connecting Point initiative.
Thank you, Wayne. Got several hats. Chief Koppenstein.
Gary Kloppenstein, Roseburg Police Chief.
Thank you. Is it Joaquina Madison?
Yes. Joaquina Madison, lead peer for Adopt Adult Outpatient, SUD.
Thank you. Jim Andrews.
Jim Andrews with Oregon State Police.
Thank you, Jim. Doug.
Doug Walton, Douglas County Crisis Intervention Team Coordinator.
Thank you, Doug. Cheryl McDonald.
I'm Cheryl. I'm the Crisis Program Director for ADAPT.
Very good. Thank you, Cheryl. Kim.
Kim Candy, Overdose Prevention with Douglas Public Health Network, and I also facilitate the Drug, Alcohol, and RX Task Force.
Very good. Catherine.
Catherine Paul, citizen.
Thank you, Catherine, and welcome. Debbie Hollander.
I'm Debbie Hollander, and I'm the Community Engagement Coordinator at Umpqua Health Alliance.
Very good. And I don't know how to, is this Rochette?
Oh,
Rochette?
I should have,
I'm
sorry.
guessing.
It's Teresa. No, it's Teresa Roach. I'm sorry. I should have changed and I'm with WorkSource, and we help people find jobs and careers.
Very good. Very good. I'll get it right after a while. Trista's iPhone.
Hi, everyone. I'm Trista Saltikoff, the Executive Director of Chadwick Clubhouse, and I work in mental health.
Very good. And we have two note takers. I don't think they, I'll go to Jen Groves.
Hi, Jen Groves. I'm new to Umpqua Health Alliance. I'm one of the new behavioral health operations managers.
Very good. Alicia.
Alicia DeVoe, Cow Creek Government Office. I'm the Tribal Intensive Care Coordinator.
Okay, thank you. Robert Wilson.
At Robert Wilson, I'm the Treatment Court Coordinator for Douglas County Circuit Court, mostly handling mental health court and aid and assist.
Very good. Thank you, Robert. Welcome. Emily.
Hey there. I'm moving around, so I've turned off my video so you don't have to look up my nose while I move around. Emily Ring, Douglas County Emergency Manager. I don't often get to participate, so I just wanted to listen in today and touch base with some of you. Thanks.
Well, thank you very much for participating. We appreciate it. And Emma.
Good morning. I'm the Mental Health Services Supervisor for ADAPT.
Okay, thank you. So have we covered everybody? Did I miss anybody? I think that's all on my screen anyway. Corey Tate is, of course, our LPSCC coordinator, and I'm Alan Hobson, the chair of this subcommittee and a Winston City councilor. So we'll move on to, if I've introduced everybody or everybody's introduced themselves, we'll go on to approval of minutes from April 22nd. Do I have a motion to approve the minutes?
I'll make that motion.
Thank you, Janelle. Do I have a second?
I'll second.
Okay, thank you. A move to approve the minutes and a second. All in favor, say aye or raise your hand. Anybody opposed? Okay, motion passes. Thank you. go on to the next part of our agenda, which is a connecting point update. And I guess Wayne is doing it today. So Wayne, you're on.
Excellent. Thank you very much, Alan. Just for a little bit of background for folks that are new to this meeting, Robin allowed me to do these meetings starting back in 2017 with Debbie way back in the day. So it was myself, Debbie, Larry Clark, and one of the girls from Peace at Home. I can't remember who it was, but we started in the old part of the courthouse, the Douglas County Courthouse, to help kind of like intervene between people that were leaving incarceration. And we decided to change it up a little bit to get a little bit more, I guess, a bigger impact. So we started partnering with local agencies, one being the Roseburg Dream Center. And we would be there one day a week to be able to help people with access to resources. Well, now it's spawned into, I don't even know, like 9 locations, I think. It's going to be the Roseburg Dream Center. I think they switched it to Adapt Primary Clinic, South River Community Health Center. Is that right, Wakina? Okay. And then we help out in Drain now. We help out in Reedsport now, Myrtle Creek. And is there any ones that I'm missing, Wakina?
Sutherland. I'm not
Sutherland. Oh,
Sutherland.
Hastings Village. Oh, I'm sorry. I shouldn't have forgot that one. So anyway.
Duck Pond and OTP as well.
Okay. Yeah, Duck Pond OTP. And that's on Thursdays, right? No, I can't even remember the dates anymore.
OTP
But anyway,
yeah.
we do, I don't anymore, but a lot of the folks, the coordinating agencies, they go out one time a week or every other week or once a month to these locations to be able to offer access to their services. And since then, it started out with the shower trailer that ADAPT provided, plus along with a couple other folks. And then it spawned into about 15 agencies, including like the Housing Authority to Salvation Army to the, I mean, it was just, there was a lot of different things and we're able to help out a lot of different people. So, and we've been able to do this all on the backs of volunteers, donating their time to be able to do this specific work. And then I know Robin's going to talk a little bit later about the primary care bus that ADAPT has, but having all these different resources in one place and meeting people where they're at, we found a really big impact. And Dane and Carly from HIV Alliance have been gracious enough to donate their time to be able to make these numbers. And that's a big deal to us because otherwise we wouldn't be able to appreciate the amount of people that we can actually help. So as of Connecting Point in April, with all services, the total amount of individuals they've been able to help in the month of April was 385. And that's going to be 171 males, 214 female. And then they had clients ranging from 13 to 17. They had 3 individuals. 18 to 30 was 50. The biggest population is going to be individuals that were 65 and wow, that's amazing numbers. 31 to 50 in that range. There were 65 individuals. And then 41 of the individuals were 51 to 64 and 7 individuals were 65 and plus. And just as a side note to Dane's notes, we've been seeing the most increase in people in that 65 plus demographic. What's scary about that demographic is you're finding seniors that have no resources, that have never been homeless in the past, having to navigate all of these resources. So that's kind of freaky to us. And then the shower trailer, Adapt shower trailer, they've been able to shower 101 individuals. So if you were to take that and you were to unduplicate it, you're looking at 140 people that had ID, 56 females, 84 males, 116 I don't know what that is, but 91 unduplicated people for showers. So that's actually a pretty big number. And then going off to different services, wound care, they handed out 206 wound care kits. And unfortunately, HIV Alliance is no longer able to provide syringes in parts of Roseburg. Naloxone, 202 doses, miscellaneous supplies, 186. Hygiene and sanitizer, 178. Smoking kits, 97. Food, different kinds of food, 90. Condoms, 58. NEX services, 40. fentanyl test strips 39, pet foods 34, in-person testing was 13. And then let's see here. They put in there that we have relocated Wednesdays in Winston to move back to South River Community Health Center, which is ADAPT Integrated Health's primary care in Winston, right across from Carlos's. And they have begun a once-a-month service in Reedsport. And the Reedsport was at Umpqua Bank, which they found out was kind of distracting for their customers. So I think they're going to be looking at a different place where they can be, helping out in that way. So, but if you do have any questions about how you can participate, if somebody is on this call that isn't participating in Connecting Point that would like to try it out, you can always contact people of the Connecting Point group, either being myself or Dane or a lot of different folks. It could be Gene McVeigh, it could be Joaquina, it could be anybody. Kim probably would know all of it. I mean, there's any of those folks if you want to participate. So, any questions for me that I can't answer?
Wayne, I know that, and I tell this to Dane all the time too, I'm always very impressed by the number of people that Connecting Point helps out every week, every month. It's amazing. And how many, even though we attempt to tell everybody what they do, it still is amazing how many people don't understand the work that Connecting Point does. And when I share it with people, they're always, I guess the light under the barrel still isn't shining bright enough because a lot of people still don't understand, but great work out there.
Yeah, so I mean, it started with the LPSCC, and going forward, Corey is doing a wonderful job helping coordinate all of these efforts, which is absolutely wonderful. I mean, to the point where, Josh over for ADAPT over in Coos or North Bend has taken that on with Dane, and they're developing a massive Connecting Point over there, which is probably going to be better than ours at some point. They've got a lot of great motivation over there right now, and they're starting one up at Curry County. The idea of just getting all of these services together, and ADAPT is running a lot of the boots to the ground, helping people out, getting organizations to volunteer, and Dane, of course, is helping coordinate those efforts and stuff. So it's been pretty cool. I mean, it would be nice to be able to find some funding for it at some point, to better help with, I guess, specific things. If it is the tents, tarps, and sleeping bags that nobody likes to see in their parks anyway, but they end up there kind of thing, to other kinds of things that would directly have a big impact with, on the people, with not a really big impact out in the environment, would be great. So if anybody is in a spot where they would like to be able to help with funding sources and maybe helping Connecting Point move forward with that, that would be kind of cool. But other than that, it's just been wonderful.
And it took off from such a very small beginning, and I remember that too, Wayne. It was quite a growth from when it first started. Thanks for all the information, Wayne.
Yeah.
Moving on to our behavioral health updates. Cheryl, do you have some updates for us?
I do, yes. All right, I will start with impacts. We are a little over halfway through Q2, and there has been exceptional growth. I think UHA is going to be really impressed at the number of services and supports we provided. We've done 612 services during 321 encounters. We still have 5-6 weeks of the quarter left. So 50 of those were jail in-reaches, and we provided 105 housing services. So exciting things that we're doing in the jail. We're filling out housing applications. We're dropping them off. We're doing Oxford interviews from the jail. We did our first ASAM from the jail, which allowed that cohort member to get from jail directly to treatment, and it was beautiful. So really, we're excited about what we're doing in the jails right now. Success stories, because I always like success stories. We have subject 597, who I talked about a little bit last time. They are 6 incarcerations within 1 year, 2 ED utilization. So that wasn't a high one, but the 6 incarcerations are what qualified them for the cohort participation. They have been clean and sober since discharging treatment in March. They are connected with supported clean and sober housing. They are employed full-time now. They are driving legally now. They are working on permanent housing applications. So we're now in this position that we get into with impacts members where we have to start doing this handoff between, I don't want you to depend on our team too much. I want to hand you off to all of these wonderful agencies in the community that can act as your natural supports. And so that's a really amazing place to be with this person. And I think it speaks to the beauty of the impacts program. So in the month of April, that one individual was able to access the program for 19 phone calls and case management on 17 different dates in just 1 month. So it's this really intensive program of not just come in every other week, but I'm going to literally contact you almost every single day of the month and make sure that you're doing well. And I'm going to invest this time into your treatment. So I think that's part of why that program is so successful. Resolution rooms so far in this quarter, their use is down a little bit, and that is okay. We've had 16 stays, and so still the same kind of variety of reasons that bridge go between sobering center and detox, getting people into inpatient placement, bringing people down who maybe have relocated out of town. They're in Eugene or Medford, and they have an early morning court date that next day. That's an excellent use of those rooms. We can help support our folks in getting to court on time and avoiding additional legal charges. Mobile crisis was super busy. We are going through some staffing changes. I don't know if y'all have ever gotten to meet our mobile crisis supervisor, Mariah, but she, for some reason, she wants to have a personal life. And so she's getting married and moving to Phoenix. And I don't understand that, but best of luck to her. She's going to be like moving at the end of this week. So I'm going to be stepping into taking on the supervisor role for a little while. We're also making some changes with switching our QMHPs to a little bit longer shift. They're going to be working more of a nursing schedule. And then hopefully we'll be supplementing with some peer support. So the faces out in the community might look a little bit different, but the services will be the same. We finished up our Q1 report for mobile, and there were 596 total calls for service. 519 of those needed an in-person response, and 77 calls we resolved with just a phone call. And so out of that 596 total calls, 86 of those were for youth under the age of 21 and their families. And so those 86 calls went into that special program for stabilization services for youth and family after that mobile crisis event. And so we are seeing a lot of growth. I just got a text from the stabilization person who said, I am taking paperwork out to a family's home because mom works 6 days a week and she's not able to come into the office to get engaged in services. So I'm taking the paperwork to her home so we can do this telehealth, and I love my job. And so that is kind of the beauty of that program too, is we really look at eliminating barriers, like what's standing in the way of parents being able to engage in services. Sobering Center has been hugely busy. They have had 42 admissions just in the last month. We are seeing a lot of duplicate patients. So we have one male that has been in 11 times in the last 6 weeks. We've set up some policies to try to discourage that as much as possible. So one of the things we noticed is that maybe people were seeing that it was a place that they could come in and have somewhere to sleep and get some food, and then With our voluntary admissions, they'd come in and eat and sleep for a little bit and say, no, okay, I'm fine, I want to go now. Or that they would come in and they had not been substance using. And so we had an incident where someone went to the store across the street and bought alcohol. So we're trying to discourage admissions like that while still welcoming in people who want to focus on treatment engagement. So any of our admissions, even if they are no longer able to voluntarily admit, will still be eligible for law enforcement admissions. So I've got some numbers and stuff that I'm happy to send to Corey, and I'm sure she'll send out for people who like to look at those things. But that's what I had to share.
Okay. Thank you, Cheryl. Any questions for Cheryl? Yeah, go ahead, Wayne.
I just got a comment. So we had at one of our facilities, we had a person that I found because I was coming on the property just to do a check, and this person was sitting on the sidewalk with no pants on, no shoes, and a shirt. And I called up Adapt Crisis, and they were there within 15 minutes, and they handled the situation just beautifully. It's absolutely wonderful. This person told me that they were dropped off. They're from Dayton, Ohio, and yeah, I didn't know what to do. I didn't know what to do, so I called them, and it turns out that this person was having a situation. And the people that handled it were absolutely wonderful, and they were able to help. And this person is doing a lot better now. And I was just very happy that they responded and that they took care of him so well.
Thank you for sharing that. I get all of the complaint phone calls, but I love hearing the really good compliment phone calls too.
Yeah, I agree, Cheryl. That, and Wayne, thanks for sharing that too, because we do hear a lot of complaints about things, and very seldom do we hear the outcomes of the really good ones. And I'm very happy to hear that. Cheryl, you mentioned, so it's still the 24/7 service, 3-6. I mean, we're still covered on all the days.
We are. Sometimes we run into a little bit of an issue. My gosh, we had 3 of our teammates out at the same time in long-term medical things. And so that made us open our eyes a little bit and think, gosh, maybe we need to rethink things a little bit. So just our therapists are going to switch to 12-hour shifts. And then we're going to kind of beef up our case managers that are out in the field and our other staff. So we'll still have a team of 2 and then a therapist that sort of floats between calls is what I'm trying to switch to. There should be more people out.
Okay, thank you. And any other questions or comments for Cheryl? And I think this is a great, tremendous program. I'm just so impressed by it all the time. Thank you, Cheryl. Lindsay, you're next up here. Do you have a report for us?
Perfect. Yeah, so our most exciting news is that we've been open for a year now. We just passed our 1-year anniversary. We also got past our Joint Commission accreditation. So that was a huge accomplishment for the unit. In that year's time, we have seen and discharged 372 patients. Our longest stay was 65 days. Generally, we're about 7 to 10 days. We are actively recruiting for another LCSW. So if anybody has anyone that is interested in inpatient psychiatric work, let me know. I also would like to start doing a group with our patients here about local resources. So if I could get flyers and information that I could share with the patients about resources after they're discharged, I would really, really love that. And that's about it. Any questions for me?
Corey, didn't the LPSCC have something going on that they had flyers that were available for people that were coming out of either detox or any of the other programs that they could have that were available to them after they were released?
We have our resource guide, and we also have a page on the county website that has the same information as the resource guide. So that's something that we have from the county.
And I could print that
Would that
out.
be helpful?
Yeah, it's printable. I have a PDF that you can download on the website. I can email it to.
That would be great.
And if others want to
Thank
email
you,
me
Lindsay.
their stuff, I can forward that to Lindsay too, or you can email her directly.
Thank you.
Yeah. It's very good. And I'm, that's what we want to do here is share information. And I know that all of us have things going on that we need to share with everybody else. And that's what I think this subcommittee is really good at. Is there any other behavioral health updates of somebody that I've missed that wants to update on what they're doing? And I think there's some more people that have come on, Corey, that I don't have on my screen for some reason.
Well, Jerry O'Sullivan came on, and I saw Cherie Barnstable on here, and it looks like Cecilia and Chelsea Gregory.
Okay. Okay, you got them all then.
Yes.
Okay, thank you. Any other updates from our behavioral health group?
I don't know if Jerry wants
Okay.
to chime in and just mention your groundbreaking date and information.
Oh, yeah.
Well, there's a rule, the state has a rule for almost everything that's a wet blanket on any party you want to try to have. So we aren't doing the, we're just getting ready to do construction when we can finally get the permits in place. So that'll be for our new campus development out on Diamond Lake. It'll be an expansion of our residential treatment program, expansion of detox. It'll include adolescent services and some housing. So the first phase of this will be the treatment programs, and we're hoping to get that started this year soon.
That is exciting. Okay, good. Hopefully you come back again, Jerry, and tell us how things are going when it actually does start.
Yeah, when we actually start moving some dirt.
Yeah, you do. That's great. Okay, go on to our next part of the agenda, housing updates. Janelle, you have some updates for us.
On the Housing Authority side of business, it's been business as usual. Our Section 8 is still not moving at this time. We are going through quite a few applications from our wait list at a variety of our other programs, such as Orchard Knoll. So if you're helping any clients for Orchard Knoll or any of our other properties, again, I can't stress enough because it seems like, they apply in crisis and then we have a hard time getting a hold of them. So we're going through quite a bit of applications just to get one unit filled, and there's housing available for your guys' mutual clients. So making sure they have good contact information. And right now for Orchard Knoll, we're working on case managed applicants up through the beginning of March. And so, and we're doing quite a large group at a time trying to fill vacancies. So, so as quickly as we can get the information in and get it reviewed and our screenings off, the faster we can get people housed. So, so let's see what else from the Housing Authority side. Just connecting with other stakeholders over preserving affordable housing in Douglas County. I think it might have been mentioned before, the Rose Apartments is for sale downtown, and that's a affordable housing unit. Mill Creek Apartments is looking at transitioning possibly out of affordable housing. So we're, working with stakeholders on that as well. And then Forest Glen has been a topic in the past, and it sounds like they've kind of stabilized for right now. So we're pleased with that. As for HTAG, the primary focus has been on resource sharing and making sure everyone knows about what they might need for their clients and sharing that information. working with community partners on the data and information to help promote good decision making in regards to the needle exchange subject that has been happening at the city level. And then just double check my notes here. And I think the biggest thing on the H tag is just making sure that the information and the work that the agency partners are doing on behalf of the community is getting relayed properly and accurately to make the best decisions possible that we can make as a whole community. So that's what's happening with H tag and the Housing Authority.
Hey, thank you, Janelle. Any questions for Janelle? So I had, so the Rose apartment is still pending, or is it going away, or is there any indication what's going to happen there?
It is for sale currently. So there's different options for it. It's still a few years away from having their contract expire for the current affordable housing subsidy. So hopefully if it sells, that contract would be extended to the new owners, but just looking at the rehab needs of the building as well is a challenge, I think, for buyers. And the overall size and funding availabilities for that rehab. So bottom line is it is for sale. I think, stakeholders are talking about options, but nothing has come to fruition as a solid plan right now. So.
Okay. So your initial comment about having to go through all these applications, so getting an update on people that need housing, but they don't, you can't find them. They're connected. Their information is not always available when you need it.
Correct. We have Orchard Knoll, for example, is transitional housing. And so we have a lot of turnover there because it's intended to be transitional. But we have quite a few vacancies available, and it's just the amount of applicants we're going through to get somebody screened from start to finish. They either are hard to contact or impossible to contact, or we don't have good information for them anymore, or maybe their housing crisis has been solved, which is a good thing, or we're struggle getting the information that we need for them to complete their eligibility process. And so it's taking quite a bit longer to fill units and to get people housed. So we're actually going through, we might go, through 20 people really fast on a wait list in efforts to find someone that will get all the way through the screening process. And so there's a combination of factors to why that happens, but I just want to share that out there that we have units we're trying to get filled. And, Orchard Knoll has the first preference is veterans. The second preference is case managed non-veterans. And so that's where a lot of the community partners on this call come in, is that if you're working with clients that have applied there and that are ready for alcohol and drug-free transitional housing, we're filling units, and we typically can get them into, it's one of the lower wait lists there is out there as far as getting a veteran or a case managed individual into housing, as long as we can find them. And they're still interested or in a position to be able to get that housing or follow through with the things that we need to get them in that housing. So.
Okay. Well, at least you have openings that you're trying to fill rather than having a wait list that just sits there and because you have no openings. But yeah, it would be yeah. So good report. Thank you, Janelle. Any other questions for Janelle, or any other housing updates of anybody that wants to share something on their housing update? Okay. Moving forward on the Adapt Medical Trailer. who is on board for giving an update on the ADAPT medical trailer?
So that will be me. Corey, can I, it's not letting me share.
Oh, there we go.
Okay,
Little screen pops up. I just hit allow.
thank you. You'll have to bear with me. I don't do Zoom very often, so hopefully, let's see.
Okay, we can see it.
Yes, but you're seeing my presenter notes, right?
Yeah, so if you go in that upper left corner, you can click from beginning.
There we go. All right, thanks guys. Thanks for bearing with me on this. So I'm Robin Peterman, Director of Operations with ADAPT Integrated Healthcare. Thank you guys so much for having me here today. It's a pleasure. I'm excited to share an overview of our mobile medical clinic, what it offers, where we're currently providing services, and helping us reach individuals who may otherwise face significant barriers to care. This effort wouldn't be possible without the strong partnerships and community support that surround it. So thank you guys so much again for us being here and to get to work with you. Okay. So our mission and values guide everything we do at ADAPT. Are you guys still seeing my slides okay?
Yes.
Okay. And the mobile medical clinic is a direct expression of that commitment in action. This clinic allows us to show up for people in a way that is consistent, compassionate, and grounded in dignity. For many, it creates a softer, more approachable first step into care, one rooted in trust and respect. We know that individuals we serve often face significant barriers, so we approach every interaction with care, empathy, and unwavering belief in each person's worth. Our goal is to provide care that's not just clinically sound, but welcoming, accessible, and trauma-informed. We want every patient to feel seen, safe, and supported from the very beginning. Sorry, guys. Okay, now it's not going. What did I do?
Hey, Robin,
Yeah.
when you shifted, you probably shifted to a different document. Just click back on your document again and see if it'll let you click. Yeah, there you go.
Okay, thanks, Jerry.
Yeah.
We know that even the best health services doesn't matter if people can't access them. So the mobile medical clinic was developed with the exact challenge in mind. It's our way of bringing high quality care to people who face these barriers. Whether it's transportation, stigma, housing insecurity, or a lack in traditional healthcare systems, for many of our patients, this is the first step back into care or their first time ever receiving it. So this is our mobile medical clinic. It's a 41-foot mobile unit designed to function just like a traditional clinic, but the flexibility to serve people directly in the community. Inside, you'll find 2 private exam rooms, a check-in area, and a restroom, creating a professional, respectful, and comfortable care experience. We staff the clinic with licensed medical providers and support staff, and we coordinate with Oregon Health Plan assisters to help individuals explore coverage or connect to other resources. The most important thing is that no one's ever turned away due to an inability to pay. We offer services on a sliding scale, but the bottom line is that it's not about the paperwork. It's about getting care to the individuals who need it most. Whether someone's insured, uninsured, or just unsure where to start, they're welcomed here with dignity and compassion. So this photo shows the main hallway inside the mobile medical clinic. And yeah, while the space is compact, it's designed to support smooth, respectful transitions for patients as they move through their visit. Typically, the check-in process has been outside the unit, led by our healthcare service coordinators. This helps maintain patient privacy and keeps the indoor space calm and focused on clinical care. Once check-in is complete, a medical team member will come out to greet the patient and guide them into the clinic when it's their turn. The layout allows staff to move patients through the unit efficiently while maintaining a quiet and private environment. For many of the individuals we serve, especially those navigating housing instability, anxiety, or even previous negative experiences with healthcare, being welcome into a space that feels safe, predictable, and non-judgmental really makes a difference in how they engage with care. Our mobile medical clinic was created to meet a very real need, bringing essential health services directly into communities that often face barriers to care. One of the biggest strengths of this clinic is its ability to meet immediate needs. From wound care to flu testing, we're able to treat common health issues right on site, offering fast, effective care to people who might otherwise end up in the ER or go without treatment altogether. It's about meeting needs in real time and keeping folks connected to the care and the pathways that support their long-term health. From same-day services to chronic condition management and preventative care, the clinic helps bridge some of the deepest gaps in rural healthcare. This work wouldn't be possible without the incredible support of our county commissioners. Their partnership reflects a strong shared commitment to expanding access across our rural and underserved communities. It's a true collaboration, and together, I feel like we're making a real and lasting difference. So on this page, we're looking at some of the services that we're providing right now, and it's a powerful snapshot of the wide range of care that we're offering through the medical clinic. So we're doing urgent needs, wound care, strep and flu testing, to long-term support for chronic conditions like diabetes and high blood pressure. And we're meeting people where they're at, both literally and medically. Preventative care is also a really big focus. Services like pap smears, skin biopsies, and toenail procedures, and along with behavioral health screenings. We're able to do telemed with some of our integrated behavioral health providers right now. And everything we do is rooted in a trauma-informed approach, helping ensure that patients feel safe, respected, and supported in every interaction. This image shows where our mobile clinic is currently parked when not in use. Our site is on Diamond Lake Boulevard in Roseburg. This is our home base where we restock supplies and ensure unit is fully equipped before heading out to serve the community. But honestly, this slide is about where our next steps are. So we applied for a grant through the Oregon Health Authority to help us expand even further our services. So if awarded, the funding would allow us to offer additional screenings like EKGs, cholesterol checks, HIV and Hep C testing, and increase our reach into harder to access communities like Glendale, Riddle, Camas Valley, and Elkton. Our long-term goal is to bring more care to people in more places. We want to grow thoughtfully and strategically while staying grounded in the same compassionate, patient-centered model that ADAPT has. That's hard to see, I'm so sorry. But this is our flyer. When I went through my PowerPoint, it was the right size. But right now, every Monday, we're at the Dream Center. We follow the hygiene or shower trailer, as Wayne called it. On the first Thursday of each month, we're at Community's First Thursday event at DHS. And then all the other Thursdays, we're at ADAPT's opioid treatment program. And we found right now that by partnering with trusted, familiar sites that are already embedded in the community, we've been able to build strong rapport and reduce the barriers people might feel when accessing care. So that is it. Is there any questions for me?
So Robin, right now, other than the Monday you were at the connecting point, and the Thursdays you're out, the rest of the time the trailer is pretty much at the Diamond Lake place.
It is right now. In the grant, we are also looking to help financially help support more staff, as well as we've had some outreach from different communities, as well as the CCO out of Grants Pass area, that we're looking to reach out, like I said, Camas Valley, Riddle, Glendale, and those areas. And the CCOs have been really supportive about trying to get people scheduled with us during those times. A lot of people don't have transportation, or they're so remote. They can't get in anywhere, to be seen, or they don't. So we're working on that piece, trying to figure out how to get this out to those locations for people that would never come in and get any help.
That's this program is a much needed program, and I'm certainly hoping that it can continue to expand because it has great potential for all of the rural areas that are really underserved for medical needs. Any other questions for Robin? Any other comments? Thank you, Robin, for a very good presentation. Going on to our other roundtable updates. Lori, do you have the other updates?
I did put a little thing together for grants. I did want to say though, on the medical bus, one end you had a wheelchair access, so you could lift someone up in a wheelchair for their exam. Is that correct?
That is correct.
I just wanted to throw that out there.
The other thing I wanted to mention too really quickly is that we are asking questions to kind of track as we see people. The questions are, if you weren't here seeing us today, what would you have done? Gone without care, ER, urgent care? Would you have seen a PCP? When was your last medical visit? And do you have an established primary care provider? And that way we can kind of see, who we're reaching and the difference that we're trying to make, and be able to show those numbers to everybody.
Okay.
All very good questions.
Okay. You see my screen?
Yep.
Okay. So I just put something quick together this morning. Sorry, could have probably added more. But I know a lot of people have been questioning where things are sitting because of the uncertainty with funds coming from federal things. So right now I have 7 grants that I'm involved with. I didn't put 1 through 7 on here because I lumped some together, but the first one's treatment court. So we do drug court, mental health court. We have the impacts one, which is mobile crisis. JRP stands for Justice Reinvestment Program. So that covers RSAT and transitional housing. We have our Bureau of Justice Assistance Second Chance, Second Chance Act grant. I'll change that before I email it out. That was for us to be able to hire the discharge planner in our jail. And then the other one, we have jail grants that I've helped with for the federal RSAT, which let us hire a dedicated deputy for the program. And then the MAT program, which is medication assisted therapy. Forward. So the first one for treatment courts, sat through some meetings to go through that. And the project period for this next biennium is going to be July of this year to the end of August in 27. So they'll have a little bit of overlap, but we should have have the contracts end in November of 27 for this next biennium. So they're still going to continue with their disbursements. We're not really seeing interruption with this. Last time they increased the amounts by 5%, and they're telling us we should be able to have at least that same amount for our courts. So we went through the preliminary piece, but we have not yet received the next phase of paperwork, which is our grant budget sheets. So once we have that in, then we'll get to figure out exactly what all we'll be able to cover moving forward. And so they'll get us our feedback, which I'm still waiting for. We haven't had that yet. And then we'll do our updates. I'll work with both court coordinators and we'll get that in by the final application deadline, which is July. And the Criminal Justice Commission should make their final decision in August. The next grant is Impacts Mobile Crisis, which is what Cheryl talks to us about each month. So I just like this slide that they showed on the grant commission meeting, because these are all the counties involved currently that are part of the Impacts grant. And along here are some of the counties listed. This was just a chart that I wanted to add to show you guys. They were showing, you know, differences between the counties or tribals groups as far as utilization. So for Douglas County, we showed criminal justice, emergency department visit, and then folks going to the state hospital. So now what? This is the grant I'm most concerned about. We have 11 counties and 5 tribal governments currently involved. Project periods ends June 30th of this summer. There's 2.55 million remaining in unallocated funds. There were 5 county/tribal entities that were almost out of funds for this time period. And so what they're doing is opening up to give them some extra funds to get them through. And they're allowing those of us, like us, we still have over $1.5 million left in ours. So they're allowing us to extend our project period at no cost to December 31st of this year. The reason why we have so much money in here is because a lot of that's going to infrastructure towards the new campus that Jerry Sullivan talked about. So this will still keep funds coming in for Cheryl's work, but it will also have quite a bit set aside to put towards what Jerry Sullivan's working on with the new campus. And then they just couldn't tell us if we're going to have more money than what was already showing as unallocated. What they've done is add deflection programs into Impact, so it's not just mobile crisis anymore. And so they put a lot of money towards deflection, and it sounds like they didn't put a bill in towards mobile crisis. So they're kind of waiting to see how things land once the legislative session ends. So we should know more after July, and then I can update groups. For the Justice Reinvestment Program, this line that you see across here is what the state can considered as a baseline to look at. And so it's just about 1,500. It doesn't look like it really aligns on there, right? But that's their baseline. So as you can see, we're not out of the norm from other areas, but we do have peaks and valleys. We definitely had a dip, you know, post towards the end of COVID era. We also had a good dip last year, but so far this year, they're showing us above the baseline. That just means we're having more arrests and more people getting in trouble. What this slide was showing from them, this is from the state stats, so it's not something that we turn in from our community. They pull it from their state site. So we're getting a lot of people with property crimes. And as we've seen with some of the unhoused, I'm not saying all of them, I'm not trying to generalize that, but well, not even necessarily unhoused, maybe more drug use. I should go that route. Some folks are going to property crimes just to help feed their addictions, but not all of them again. So I'm not trying to generalize or upset anyone on that, but this is just showing what our numbers were. And then this is a comparison to the state. So the state is the black line. We are the red line. And then up here it shows the other counties. So they tried to compare us to some nearby folks. So we're kind of in the middle with everybody. Some of our peaks are not higher than others. Some of our dips actually come down below the state and everybody else. So we're just kind of all over the board. Especially since coming out of COVID, everybody's been able to get people back in their jails and go through their regular processes with the judicial system. So for our grant for justice reinvestment, they didn't really have any clarifications. They just want us to explain our increase since we are above the baseline so far for this last year that they looked at. And I sent that to the court coordinators and also to the director for the, which is Joe Garcia, to see if he has some feedback that he would like to give me to provide to them for that. And then our final applications, once we get the grant worksheets, will be due July 25th. And then the last ones that I lumped together, I'm sorry if I'm going too fast. The Bureau of Justice Assistance is the Second Chance Act grant. This is federal. Unfortunately, our technical advisor, they were told to cease all grant work with the grantees because of federal funds, but the funds that we already have are still good. Because this was awarded to us in October of 22, we didn't get to hire Rochelle as our discharge planner until April of 24. So we went quite a span without being able to really expend hardly any funds. So they are allowing us a 1-year extension. So we'll still be able to pay for her position and keep things going status quo in September next year. With that, we are doing a slight adjustment to our agreement because the jail is going to be working with a new medical provider. We're switching to MedTrust from WellPath. And then we have a small federal RSAT grant that's filtered through the Criminal Justice Commission, which is state. And that was used to hire the dedicated deputy for the program. And so we're in the current 2019 funds, but we're still moving forward with the next grant cycles. They don't see any disruption with those at this point. And then the JMOOD grant, which is for the medication assisted therapy, that was only a 1-year grant from the get-go. So we knew that that was going to end in September of this year. And they, at this time, are not opening any new grant funds for this. The jail did have previous funds through a different grant that they were using and actually started this program right before I applied for the 1-year grant option. So it'll be up to the jail to continue what they had worked on prior to what I got to fill in their immediate gap. That's all I had for that. Did anyone, let me stop sharing so I can see people. Apologize, it went really fast. I just want to give an update because I get a lot of questions about, oh my gosh, I hear, coming down from Trump, and everything else that, things are seized and stopped. But for us right now, we're sitting okay with our grants. The only one I don't really know about, like I said, is the impacts one. And that's the program I love, and I hope they make sure they can help fund us so we can keep moving forward on that one.
Yeah, that grant is definitely a must-have grant. I agree. Hopefully that'll go forward.
Yeah, I mean, they're only going to spend, I think, around 800,000 of that unallocated for those 5 county/tribal groups to kind of keep them up with the rest of us for the rest of the year. So we would still have, a little under 2 million that I guess they could ask for applications to see who still wants funds to move forward. So we could potentially apply for that. But I'd like to see it higher because I think our total award over the years from this starting right before I was hired and then through now is, I think we're now over 4.5 million. So this was a big one.
Yeah. And a very important one.
Yes.
Any other questions for Corey? Okay. Anything else, Corey?
That's all I had, unless people want to know the next Hope Drug Court scheduled for August 26th, which is a Tuesday at 5:15 at the fairgrounds again. Right now we have 5 women and 2 men that are in the graduate phase part of this program, and will be, well, actually they've been meeting with me last week and this week to talk about community projects. So right now we have some pretty good ideas coming forward, but I'm not going to share anything yet because they have to pitch it to a panel for approval. And once we get that, then we'll move forward. And I'll start sharing flyers once we make them.
Okay. Okay. Do we have anything else?
I was just going to mention that, are we on roundtable or are you just anything else in general? Sorry.
Yes. No, go ahead. Go ahead.
I was going to mention that
anything in general.
Janelle alluded to earlier that the city council has done first reading on an ordinance prohibiting distribution of needles on public property, on city property, unless there's a medical necessity. And then at the next city council meeting, I'll be taking an ordinance before them for public indecency to prohibit that. So just wanted to share that with everybody.
Okay. I think that was, I think I saw that in the news report, yes. Any other comments or questions overall, updates? Anything else, Corey?
No. Anything else?
Okay. Okay. And I'd like to, my main comment is I've been sharing our group's information all around with people that I interact with, and the amount of, I don't want to say false information out there is amazing. So it's always nice to go through these meetings and get the right kind of information and be able to share it, and people perk up and say, oh, I didn't know that. I didn't know those things were going on. I didn't know we were doing that sort of thing. And so I appreciate everybody that comes and shares what they're doing. And we know we have a problem with a lot of different things, but we are working on it. We're managing it. It's never going to be completely taken care of, but we manage it on a day-to-day basis. And I think that all the people in this group do a great job, and we just need to keep shining our light, because there's a lot of people out there that have the wrong information. So I appreciate everybody coming. Our next meeting is June 24th, same time, same place. I appreciate all, and if there's no other comments, I will adjourn the meeting.
Thanks, everybody.
Thank you.
Thank you. You guys do a great job, really.